Hi, and welcome to another episode of Get Your Chat On with GYC Vegas, recorded and produced at the Video Podcast Studio. I'm your host, Gina Yager, founder and director of GYC Vegas, an award-winning PR and marketing agency. We believe every company has a story to tell, and we're passionate about getting businesses recognized. At Get Your Chat On, we sit down with local professionals to get to know a little about their organization, their role, and their perspective on our vibrant business community here in Southern Nevada. On today's episode, we're chatting with Stacey Zierath, Chief Executive Officer of Las Vegas Recovery Hospital, bringing more than 35 years of healthcare operations experience to her role. Previously, Stacey served as the Associate Vice President of Regional Operations for Pediatrics Medical Group, overseeing physician operations across 15 hospitals in Nevada and Northern California, including 9 facilities in Southern Nevada. Throughout her career, Stacey has held leadership positions in several large healthcare organizations, primarily in the Seattle area, and earned a master's degree in healthcare administration from USC. Deeply committed to community service, Stacey has served on the board of directors for Ronald McDonald House Charities of Las Vegas, Vegas Food Rescue, and Peace Officer Way of Whatcom County. Passionate about improving lives through recovery, Stacey's dedicated to supporting individuals and families affected by substance much.
Happy to be here.
Good. Well, tell us about Las Vegas Recovery Hospital and the vital services that you provide for our community.
So Las Vegas Recovery Hospital is a new hospital, and we are located in Henderson. We're actually a hospital within a hospital. So we're located on the Dignity St. Rose de Lima campus. We're taking the 3rd and 4th floors there. We will have 68 beds when we open. We are focused on substance abuse, treatment, detoxification, and acute medical stabilization. So we're actually a little different than a typical detox facility. We focus on acute care. We're licensed as an acute care hospital. So what that means is we have patients that will come in who need to detox from alcohol or drugs, whatever their substance of choice is. And they also have other health conditions such as diabetes, high blood pressure, different heart conditions, liver failure, kidney disease, things like that.
I want to inform our listeners, because I know that there was probably maybe an education gap in understanding the difference, especially when we're talking about substance abuse patients, of rehab versus acute hospital.
Yes. So a rehab facility is typically a residential program. So a patient can go there and they can detox, and then they'll have a residential program typically lasting about 30 days. It's a little lower level of treatment. It's still vital in the recovery process. But what we're doing is we're stabilizing the medical conditions in addition to helping the patients detox. Their stay with us is going to be shorter. It won't be a 30-day stay. And then we'll be focused on discharging them to the correct level of care that they need after they are going through detox and stabilize their medical conditions.
And I know this is such a vital, this is the first recovery hospital that is specifically, or an acute hospital that's specifically designed to serve this community.
Yes.
Talk about how you were filling that gap within the community and what those partnerships will look like with other healthcare providers.
Yeah, absolutely. Well, we look at this as a safety net for the patients and families in the community, because these are services that aren't provided today. So we want to make sure that these patients don't fall through the cracks. The other piece, as far as partnering with the health systems, I see this as a partnership. We're not here to compete. We're here to fill that gap and to help them be able to see the patients that they're best suited to see, and we will see the patients that oftentimes don't have a place to go, and we'll be able to take care of them in a dedicated, focused environment.
Let's talk about finding your true calling. We'll go back to your career. You have over 35 years in healthcare operations. How did you first realize that was the path that you wanted to follow?
Well, I was working in a law firm when I got out of high school and was starting my college career. And they focused on medical malpractice and personal injury.
Oh.
And so as part of my job, I was going into all the hospitals to pick up medical records, and was typing up documents. I was learning a lot about the medical field on the legal side of things. And I thought, I'd like to work in the medical field. So I decided to apply for a job at Swedish Hospital, which is a large hospital in Seattle. and was brought on board to be a research secretary to a world-renowned cancer researchist. And he had no idea what to do with me. So what I did was I learned every single job possible, and that was really the foundation of my career in healthcare. And I just took it from there and continued to grow and learn and take on new positions, and just I love it.
And talk about your career. What led you to Vegas, Las Vegas, and then eventually to join this new team at Las Vegas Recovery Hospital?
So I've always loved Vegas. I'm from Seattle, and if you know anything about Seattle, it rains a lot, and it's drizzly rain, and it's gray. So I used to visit Vegas, 3-4 times a year, just because I loved it. I loved the sun. It was fun to come down here, sit by the pool. So I always thought maybe someday I'll have a job in Vegas. Who knows? So it was one of my dreams. Didn't think it would actually happen. But through some career changes, I had the opportunity to actually move to Reno for a year, and I was working for one of the health plans up there. I was working on the payer side for a bit. And then the position with pediatrics came up, and they said, we'll move you to Las Vegas if you take this job. And I thought, here we go.
Here's my chance.
Here's my chance. And I picked up in 2 weeks and was in Las Vegas. This position, when it came up, was presented to me. It just spoke to my heart and my North Star and what my personal mission is helping people. And sometimes I feel like it sounds a little cliche if you're in healthcare, but I truly believe that. That's what I want to do. I want to help people. This patient population is often stigmatized. There's, forgotten people. It's hard. It's a hard field to be in, but it's vital. And, if we can help people who are in vulnerable situations, that's absolutely what I want to do. And, my goal is to leave a legacy that I've helped people in whatever way I can.
Speaking of that, working in recovery services requires tremendous compassion and resilience. What part of your work gets you motivated to start each day?
Well, I get up each morning and I go and I kickbox at Relentless Fitness.
Nice. I have to give them a shout out.
I have to give them a shout out because
Yeah.
they keep me healthy mentally and physically. So I think that's a good foundation. But when you love what you do, you don't go to work. So I love what I do, and it's easy to get up and start my day. And every day is a little different, and it's exciting. And I know I'm doing something good for the greater good.
And it must be excited to be starting from the ground up with something that's launching. You're in an office right now that is being built out. You have 2 people on your staff right now, and you're building up to a 68-bed hospital.
Yes.
So, tell us about a little bit about what it's like to kind of start something up from scratch.
It's super exciting. It's not for the faint of heart because there's a lot of unknowns. So if you're somebody who likes to live in the black and white world, you're not going to be able to survive this. But it's fun. We're doing everything. So right now we are a staff of 2, myself and my director of nursing, Christy Benjamin, and she is amazing. And we're doing it all along with the help of our corporate team that's based out of New Jersey, and it's a blank slate. So we get to really put our heart and soul into it. Sometimes it's like, what are we going to do with that? I guess we'll figure it out. But when we open up, I'm going to know that I have touched every single part of that hospital and every part of the patient experience and staff experience, and that's very fulfilling.
It'll be exciting when we listen to this episode because you will have opened by then.
Yes.
This will air probably in January. There will no longer be 2 employees. There will be a full staff.
Yes.
With an operating hospital, and can't wait to celebrate that grand opening with you. You're deeply involved in organizations like Ronald McDonald House Charities, Vegas Food Rescue, super involved with your church, Canyon Ridge. And many others. How do you see the connections between healthcare and broader community wellness?
Sure.
The community connection.
Yeah. Well, it's interesting because I did end up having to resign my my board membership with Ronald McDonald House because of the change in positions. But when I was talking to their CEO, she said, we may still have some opportunities for partnership because oftentimes the families that come into the house who have children that are in the hospitals have substance abuse issues and challenges or are facing some serious health issues along with substance abuse and potentially need detox. So
Wow.
that's a powerful connection right there.
Yeah.
When I look at the church I attend, which is Canyon Ridge Christian Church, and then Central as well, they have programs called Celebrate Recovery. And so they're very involved in the recovery community and helping to transition people who want to get clean and sober and sustain that recovery. So I see a partnership there as well, because we will want to refer our patients on to the next step. What's next after you detox and you are stabilized? We need to have places like that to refer our patients to. And I've also thought about having them come in and run some groups and AA, NA. There's going to be a lot of community groups that we will lean on to support our patients in their success.
Pushing boundaries. This is just such a new concept here for Southern Nevada to have a hospital like this. How would you say that Las Vegas Recovery Hospital is pushing those boundaries of what's considered possible in addiction treatment and recovery services?
Well, we're doing something that hasn't been done. And, there are a lot of reasons why hospitals like this don't exist. And, being a pioneer to take that leap and, there will need to be some probably payer reform, healthcare reform around reimbursement rates for substance abuse treatment. But our model is different. So we will be successful, and we are pushing the boundaries to create the safety net for our patients.
That's so exciting. Professional advice. What are some of the most valuable lessons you've learned that could benefit others starting in their career? You talked a little bit off camera about your education experience. Yeah.
Well, I am a non-traditional student, and I obtained my bachelor's degree in 2018 and my master's in 2020. So obviously a little later in life for me, but I worked my way up. And, I talked about how I started in healthcare and, and I had started in college and then started my career and had my family. And I continued to just learn and grow and promote up and take that next step and take that next step. And for a long time, I wore that as a badge of honor that, I did this without having my formal education. And then I realized, okay, I need to have my formal education. It's time. And one of the best things I could have ever done. And so I guess my biggest piece of advice for anyone is it's never too late. It's never too late to do what you want to do, to follow your dreams. The only thing that gets in your way is yourself.
I love that. That's great advice. We're going to move on to our kind of fun fill in the blank section. That's about doing business in Vegas. Okay. And so I know we're joining the chambers right now. We're getting, involved in the community to create buzz and exposure about Las Vegas Recovery Hospital and its launch. So I'm going to ask you a question. You just fill in the blank. First thing that comes to mind. So when doing business in Vegas, it's essential to have a solid strategy for
networking.
One thing every new transplant should know before doing business in Las Vegas is to never underestimate the power of
relationships. That is so key. And the other piece to that is that everybody knows somebody. So if you meet someone, they know somebody that knows somebody. So take advantage of that as well. But it's, they say Reno is the biggest little city. I think of Vegas as the the smallest big city because it seems like everyone knows everyone.
Everyone knows everyone. That's so true. When it comes to connecting with a business contact over coffee, lunch, or drinks, you can't go wrong meeting up at?
Oh, boy. I don't even go out for coffee. Gosh, that's a good question. Maybe the Peppermill would be a fun one.
Oh, that would be fun. That would be fun, especially for someone who's
Old Vegas.
never been there. Yeah, exactly. Best way to unwind after a long day of business meetings is to indulge in some blank to restart your day.
Well, I like to read. So, maybe spend some time reading. And I like spending time at home with my husband and my animals and take them for a walk. Not my husband, but the animals.
Of course. Sounds like a good evening. All right, personal lightning round of questions.
Okay.
We love to, as I mentioned, ask these questions for people to get to know a little bit about you and what you're passionate about inside. If you could teleport anywhere in the world right now, where would you go and why?
Well, I would probably go home because I love being at home with my family and with my animals in the evenings. That's one of the best things. And, I love to travel, but right now I'm so focused on opening this new hospital that, those evenings at home are absolute bliss for me.
Absolute precious time, right?
Yes.
I agree with you. If you could have a superpower, what would it be and how would you use it?
If I had a superpower, wow. I would probably take away all the pain from everyone in the world if I could, if that was a superpower. So, put myself out of a job.
Yeah, I'd love that though. Yes. What's the most adventurous thing you've ever done and would you do it again?
I went skydiving a few years ago.
Yeah.
and no, I would not do it again.
I did too. And when people ask me if I would do it again, I also say no. I'm like, nope, that's a check off the bucket list and I'm good.
Absolutely.
It's been such a pleasure having you on today to talk about your career experience, talk about the launch of Las Vegas Recovery Hospital. Yes. How can people follow what the hospital is doing, just any announcements and things, and you as well?
So we are on LinkedIn, we're on Facebook, we're on TikTok, and we're on Instagram under Las Vegas Recovery Hospital. So you can find us on all of those pages. We also have a website that is lvrhn.com. So Las Vegas Recovery Hospital, Nevada. But it's the initials.
It's the initials.
And then I'm on all platforms of social media as well, including LinkedIn.
Awesome. That's a wrap for today's episode. Be sure to follow us at GYC Vegas on Instagram, Facebook, X, and LinkedIn, and subscribe to our channel wherever you stream podcasts. And if you want to learn more about how your business can enhance its marketing efforts through the power of PR, visit our website at gycvegas.com. Thanks for listening to Get Your Chat On, and we'll see you next time.